what you found was that there is actually sufficient credible research to point you in the direction of using sun therapeutically, and that there may be more benefits to the sun beyond just raising our vitamin D, because people who raise their vitamin D with supplements weren't showing the same outcomes. Is that
Correct.
okay?
Correct. That's exactly right.
So what was the next step? So we were like, okay, wait a minute. The sun has benefits beyond just what we were told. Then what
Yeah.
happens?
So you know how it is. There is the stuff that you know that you know. There's the stuff that you know that you don't know, and there's the stuff that you that you don't know that you don't know. So the very first thing that I did was I went to the internet and I just searched PubMed for all of these peer-reviewed articles and things that have been published on this, because we live in an age where there's just so much information, so much good, credible information, that the real rate limiting step in our understanding is being able to process it, find it, look at it, read it, understand it, and go from there. And what I found is a plethora of very good quality studies that all seem to point towards and indicate that there are components of sunlight, specifically in the near infrared spectrum, that have a tremendous effect on our body, that can penetrate through our skin deep into the actual core of our body, and actually affect changes that can change not only our ability to fight infections, but also have a great effect towards our metabolic health. And there are studies out there that show this very clearly, maybe not in a randomized placebo-controlled way, but in very good evidence way and in a dose-dependent way. And then if you look historically at how sunlight has affected people and how sun has been used by people, you put it all together, it's a very compelling argument.
Yes, and we've certainly seen that. I mean, I've, over the last sort of 5 or 6 years, have been connected with a lot of people, including myself and my family, who have come to this conclusion and made sunlight a daily part of their lives. And I don't know anyone who didn't see positive benefit from it. Like, nobody who makes that switch, unless they don't really know what they're doing and they fly to Mexico and lie out in the sun at noon after being in Minnesota in February or something. But
That's the problem.
barring that,
yes,
just the practice of going outside where you live on a regular basis, I have not seen anybody who didn't have significant improvements to their life from doing that.
Absolutely, yeah.
Anecdotally speaking.
Right, and in terms of the studies, the one that really piqued my interest early on in looking at this was a study that was done out of the University of Edinburgh, and they looked at the United States, they looked at the UK, and they looked at Italy. And in this study, they looked at specifically COVID-19 patients and mortality rates in COVID-19 patients. And they did it during the winter time. So obviously in the Northern Hemisphere, in the winter time, the sun, for most of that extreme Northern Hemisphere, isn't going to have enough UVB light to produce vitamin D. And so they looked specifically at those places that were not getting any of that UVB, so that vitamin D was no longer even a factor in determining. So the production of vitamin D was not a factor in that study. Yet it still showed in that study that the higher in latitude you went, that the worse the mortality rate in COVID-19 was. And what they showed was that there was something else in sunlight other than UVB making vitamin D that was predicting the mortality in COVID-19 patients. Another study that was done this time in Europe looked at the autumn 2020 surge of COVID-19. And what they showed was that when they looked at all of the countries of Europe, that it wasn't humidity that determined when they would get their surge of COVID-19 in the autumn of 2020. And it wasn't temperature that caused it either. What it was simply latitude. So what you saw was the very first country to get the COVID-19 surge was Finland. And from there, it was a bunch of countries going down the list. Finally, the last one to get the COVID-19 surge was Greece. And it showed a very nice correlation that seemed to show that latitude, once again, which is something that, of course, that is tied to sunlight, had the most major impact in that. And so I started to understand that, yes, there's something about sunlight other than vitamin D that is having a major impact in COVID-19 mortality and outcomes. Why would that be? What I had already discovered and what I'd already learned was that COVID-19 in this case, and what I'm saying COVID-19 over and over again here, this can be generalized to just about any infectious disease, but we'll talk about that. Specifically in COVID-19 and SARS-CoV-2, when the SARS-CoV-2 virus, and it's even more particular with SARS-CoV-2, when it infects the cell, it disrupts the ability of that cell to balance oxidative stress. So I don't know if we've talked about oxidative stress on your podcast, but oxidative stress is one of the major contributing factors in most of the diseases that we see in Western culture.